Let's talk about impacted teeth. You've probably heard the term, maybe your dentist even mentioned it. We're going to break down the real story behind why getting them removed is such a common thing.
It's a pretty wild question when you stop and think about it, right? Why do we even have teeth that don't seem to fit in our mouths? Well, the short version is our jaws just aren't what they used to be, thanks to softer, modern diets. But we still have the same number of teeth trying to squeeze in. And that mismatch, well, that leads us right to our first big topic. What exactly is an impacted tooth?
So, yeah, let's start at the very beginning. What does it actually mean when a dentist says a tooth is impacted?
Okay, think of it like this. A tooth is trying to get to its final destination. It's spotting your smile, but it hits a roadblock. It's literally stuck in traffic. That traffic jam could be another tooth, a chunk of dense bone, or even just some really thick gum tissue. The point is, it can't get where it needs to go.
And who's the number one offender? Yep, wisdom teeth, by a long shot. They're the last ones to show up to the party, and by the time they arrive, there's usually just no space left for them.
So that brings us to the big dilemma, right? This is the question I hear all the time. If the tooth isn't hurting me, why on earth would I go through the hassle of getting it taken out? This quote really just nails it. The whole idea is to be proactive. It's about playing offense with your health, not defense. You want to deal with a potential problem on your own terms, not wait for it to blow up into a painful emergency on a holiday weekend. Okay, so here's reason number one, and it's a big one. An impacted tooth creates a little pocket that's almost impossible to keep clean. So what happens? You can start to get gum inflammation and even bone loss around the tooth right next to it, a perfectly healthy tooth that's just minding its own business. And for that exact same reason, these spots become a perfect trap for bacteria. This can cause a cavity not just on the wisdom tooth that you might not care about, but on the back of your second molar. And that's a super important tooth you definitely want to keep for the long haul. Now, this one sounds a little scarier, but it's important to know. Every single tooth grows inside a little sac of tissue. When the tooth gets stuck, that sac sticks around, and sometimes it can fill up with fluid and turn into a cyst. And these cysts can grow without you even knowing it, causing some serious damage to your jawbone. Oh yeah, and we've all felt this, right? That sore, puffy piece of gum covering a wisdom tooth that's halfway in. That's one of the top reasons people finally go to the dentist, and it actually has a name. And this slide, wow, it really shows you how quickly things can escalate. It's called pericoronitis, and it starts out as just a little annoyance, but it can quickly turn into a serious infection, making it hard to open your jaw and even causing fever. And the worst part, it'll probably keep flaring up again and again until that tooth is gone. But of course, removal isn't a one-size-fits-all solution. A good surgeon always weighs the risks. If a patient has health issues, or if the tooth is wrapped around a nerve, leaving it alone might be the smarter call. Especially for teeth that are completely buried in bone in patients over 30, sometimes watching and waiting is the best plan. And that whole idea of age, that brings us to our next point, which is absolutely critical. When we're talking about removing these teeth, timing isn't just a small detail, it's pretty much everything. So here's the magic number, 16 to 18 years old. This is considered the sweet spot for getting wisdom teeth out. And why? It's simple, really. At this age, the roots of the teeth are only about 1/3 to 2/3 of the way formed, which makes the whole procedure a lot easier. Just look at this comparison. It's totally night and day. When you're younger, your body is just a healing machine. Recovery is faster, the bone fills in better, and the surgery itself is usually simpler because the bone isn't as dense yet. Waiting until you're older, well, it just makes everything a bit more complicated. Okay, so you've made the call. It's time for the tooth to come out. What actually happens? Let's walk through the procedure. So it's not really about just pulling the tooth out. It's actually a very careful, step-by-step surgery. The surgeon creates a path, and often the tooth is broken up into a few smaller pieces. This allows for a much gentler removal that protects all the healthy bone and tissue around it. Now let's be real about recovery. Yeah, you're going to have some swelling and discomfort for a few days, but it's a really well-managed process. IV anesthesia makes the whole experience comfortable. Most people don't even remember it, and steroids given through the IV can get a head start on keeping that swelling down.
All right, let's bring it all home and talk about the final verdict. We need to weigh the potential risks of the surgery against the very real long-term rewards of getting it done.
Not all impacted teeth are created equal. The angle the tooth is stuck at makes a huge difference. You can see here that a tooth tilted forward, that's mesoangular, is the most common and usually the easiest to deal with. A tooth tilted backward, though, that can be a real challenge.
Okay, complications. We have to talk about them, and this chart puts it all into perspective. Sure, things can happen. Dry socket is the most common nuisance. But look at the serious stuff, like a jaw fracture. It is incredibly rare. We're talking less than 0.005%. And this quote right here is the absolute key to this whole conversation. I'm going to say it again. Asymptomatic does not mean disease-free. Just because it doesn't hurt right now doesn't mean there isn't a quiet problem brewing just below the surface. And that's not just a gut feeling. The research is really clear on this. For most young adults, deciding to wait and see with their wisdom teeth is basically just kicking the can down the road. It usually means they'll end up needing a more difficult surgery later in life when a problem finally shows up. So, we end with this final question. Is asymptomatic really the same thing as problem-free? Well, based on everything we've seen, the answer is very often a clear no. And knowing that, that's the key to having a smart conversation with your dentist and making the best choice for your health in the long run.